People go to extreme lengths in order to afford plastic surgery. Before you do, listen to what happened to Carla.
There's more to it. I'm dying. My kidneys have already started shutting down.
What are you willing to risk to achieve perfection?
That $2,000 you're saving could cost you your life.
That's what's coming up right now on Montel.
Well, he's on the board of directors for the largest accreditation association in the country and is also the Patient Safety Committee, on the Patient Safety Committee for American Society of Aesthetic Plastic Surgery. Please welcome Dr. Geoffrey Keys to the show.
Thank you so much, Dr. Keys, for being here.
And I started off the show by saying buyer beware, and I'm not going to try to put down doctors overseas, but I'm also going to say that I think that we set rules and standards here in America for a reason. And I'm not necessarily sure if a lot of patients that are seeking these kind of surgeries overseas understand that it is buyer beware, because you're not, if you were checking into a hospital in Costa Rica, the same procedures and requirements for sanitation and all those things that we have in the United States are not in place in that hospital, are they?
Well, it's even more significant than that. The same standards and procedures that we have in some states are not in force in other states. For example, for accreditation of surgery centers, there are currently only 14 states in this country that require accreditation of outpatient surgery facilities. But when you're looking into having plastic surgery, it's not just buyer beware. You have to really do your homework to understand, as you mentioned before, who the doctor is, what the facility is all about, whether it's accredited. All of the things that you mentioned before are really of the utmost importance, even if you're having surgery here in this country.
That's what I'm saying. If you were having it here, that's what you want to do. But how can you even know the information that you're getting from another country is valid?
Foreign countries do not require accreditation of outpatient facilities. They're just starting. As a matter of fact, our organization is starting to accredit facilities in Europe and in South America, and we're just touching the base of this and starting it, but they don't require it at all.
If in fact you do happen to go overseas, in Carla's case, and have a surgery done, why might be a stupid question, but why can't this lady now at least find a doctor here that can say, okay, I got it, I get it, yo, see what you've been through, sign this release that I don't have responsibility for what happened to you before, but let me fix you now, darling?
Oh, I think there are many doctors who would help her. I think that there are university centers that would help her. There are many doctors would help her. There's no question about it. She just has to seek them out and go to a university.
Well, maybe you can help us figure out, because we'll go to websites, whatever it is, we'll help seek out
Just run out of money is why we stopped.
I got you, but you know what? At this point in time, there may be, through some other avenue, we may be able to see if we can still get you some help.
No question she can get help.
All right, let me take a little break. When we come back, I want you to tell me a little bit more about the things, again, that we should look for. Is there a national website, or is there a national organization here in the United States that we can go to and say, I'm thinking about going to Norway for a month, and I want to make sure that when I'm there, I've got a hospital that's a hospital I can go to and rest assured that it's going to be clean. Is there any place I can go and search that out here and get the doctor's recommendation from the United States for a hospital overseas?
I don't think so. I think it's difficult enough to get your credentials straight in this country.
Correct.
When you're seeking care. To go to a foreign country and try and knock it down, that's pretty hard. I just was asked for a referral in Rome for a patient, and through the American Society for Aesthetic Plastic Surgery, and one of my colleagues, Fuad Nahai, who's a very well-known plastic surgeon, he recommended somebody in Rome. So I know, since he recommended this doctor to me for a patient, that it's going to be a safe situation. But to try to find it as a layperson, I just don't know how you do it.
Okay, we'll take a break. We'll be back right after this. Because one of the other things that we didn't point out here is that almost all these surgeries overseas are cash up front. There is no insurance coverage for this stuff overseas, correct?
As far as I know. I mean, it depends on where you're going, but if you have a complication overseas and you're not covered by your insurance in that country, then you might have a real severe problem with getting that complication taken care of.
So you may go over, pay cash for a surgery, and then all of a sudden wind up at a hotel with a 107-degree temperature, go to a hospital, correct it, and the next thing you know, your insurance isn't covering that too. So now you got two bills.
That may be the case.
You sit on an accreditation board. Would you recommend, if I said to you, my Aunt Betty called me last week and said, dude, I want to get some lipo, but I can't afford it. I saw something on TV, Montel, and it said if I go to India right now, geez, I can jump in there, put me up in a 5-star hotel, I'm going to get served, little pom-pom drinks, and I'm going to have my surgery and be happy. So can I go? What should I tell her?
Well, Montel, you made a comment earlier. There are fine doctors all over the world, but we have the best health care system the world's ever known as far as capable surgeons. And the quality of your surgery and result is only as good as the surgeon who provides the care. So since we have some of the best trained surgeons in the world and you're starting in this country, I think you're better off checking things out here first, and then, you know, if you can't find what you need, maybe look elsewhere.
Let me ask you a question. Is this also, though, is there a message being sent to the American health system? If, you know, so many people are running outside of the United States to find a better price, isn't there some way that maybe we can start talking to doctors here to lower the price of procedures that have become almost as second nature, and I'll say it this way, as things like circumcision?
Well, one of the problems is you're showing an example of it. When you have standards to uphold, operating room standards, if you come to an outpatient facility that's accredited, it's like a little hospital. The costs of providing that care, the nursing care, the anesthesiologist who's board certified, the equipment, the supplies, implants alone, the silicone implants that we use when we use them are $1,700 a pair in this country. So you're getting a type of quality and quality control that doesn't exist elsewhere. She had implants put in her that were in another patient. That's unheard of in this country. So it's more than buyer beware. There's a reason, and it's not just in healthcare, it's in anything. There are other industries where the regulations and the standards push up the price of the product that's produced.
Gotcha. All right, so Doc, Allison, she's still thinking about going to South Africa, having some procedures done.
Can't you talk her out of this for me?
Well, I don't know how she researched this problem, and she may be going to an excellent surgeon, and you know, if that's the case, that's fine. But if you're not really fully aware of who the surgeon is and all of the things surrounding it, if it's saving you $2,000, that can be a very expensive $2,000 somewhere down the line.
And I got to say, the $2,000, and Carla, I hate to, I'm not throwing this out as a punchline, but the truth of the matter is that $2,000 you're saving could cost you your life.
And mine cost me $110,000.
In surgeries. Let me take a break. We'll be back right after this.
I'm torn. I really am torn. Is there then this show, I don't know whether or not I should say don't go overseas or do, but I will say that it's our responsibility to ensure that we do the best we can in looking into our own medical care. We're responsible for our own medical care, so if you're going to go overseas someplace, I'm telling you, you need to research this way beyond anything that you would ever consider researching here in the United States. I'd find out whether or not I can find a doctor. I want to know where the doctor went to college at. I want to make sure that the records that he sent me were real and valid. I want to see the facility. I don't want to get on a plane and see the facility. Send me pictures. Let me do an internet search and look around and see. Just do as much as you can, because Jonathan had great results. Great results, no question. These two ladies didn't. And there are untold story after untold story after untold story of people coming into California right now having to be repaired. So I say it's not just buyer beware, like you said, Doc. I'm telling you, it's a difference between saving $2 grand or giving up my life. I'm gonna spend the $2 grand. That's what I'm doing. I don't know about you guys. Got a similar story? Contact us on our website, montelshow.com. Join us on the next Montel.